Most Medicare agents are sitting on top of a second business they don't even know exists. Every Medicare client you've ever written has a household, a network, and a community full of people under 65 who need health insurance. This training shows you how to identify those Affordable Care Act, or ACA, opportunities inside your existing book without sounding intrusive, and how to write that business year-round, not just during open enrollment. Most agents who specialize in Medicare treat ACA like a foreign country. They think it's complicated, they think it's only available during a tight window each year, and they think it doesn't pay enough to bother with. All three of those beliefs are outdated. ACA enrollments happen year-round through Special Enrollment Periods, or SEPs. The commissions stack, and the existing relationships you have with your Medicare clients are the warmest possible source for under-65 referrals. The fear underneath this is simple. You worry that asking your Medicare client about their adult children or younger spouse will feel pushy. You worry you'll seem like you're prospecting through them instead of serving them. You worry you'll lose the trust you spent months building, so you don't ask. The Medicare client walks away, and their 38-year-old daughter, who is uninsured because she just left her job, stays uninsured when you could have helped her last week. Here's the reframe. Asking about household coverage isn't prospecting, it's care. The whole reason your Medicare client trusts you is because you help them solve a coverage problem. The instinct to say, "Hey, who else in your family might need this kind of help?" is the most natural extension of that trust. You're not selling, you're offering. The client almost always knows someone, and they almost always feel good about pointing you at them. Your job is just to ask. Before we get into the how, one piece of foundation. To write ACA business, you need to be Federally Facilitated Marketplace Certified, FFM certification. It's an annual requirement, it's free, and it runs through the CMS Enterprise portal. If you don't already have it, that's step 0. Without it, you cannot enroll a client in ACA coverage, and you cannot earn commission on those policies. Get certified before you start opening these conversations, not after. Now, let's get into the system. There are 3 places to find under-65 business inside your existing world. We're going to walk through each one: the household, the referral network, and the community. Source 1, the household. Every Medicare client has a household, and every household has people in it who are not on Medicare. The most common pattern is a younger spouse. You enroll a 66-year-old husband in his Medicare plan, and his 62-year-old wife is sitting right there at the kitchen table, needing coverage for the next 3 years until she ages in. That's not a referral. That's a same-room sale. And most agents miss it because they never ask. Here's how the household question sounds. After the Medicare enrollment is signed, during the same bridge moment, you say something like, "While we're here, is everyone else in the house covered the way you'd want them to be?" Sometimes there's a spouse a few years younger, a child still on the parent's plan, or someone in between jobs who slipped through the cracks. That's the entire question. You're not pitching a product, you're asking about coverage gaps in their household. Almost every conversation surfaces something. A daughter who got laid off, a son who's a contractor and doesn't have employer coverage, a spouse who's between 58 and 64 with a high deductible plan they hate. Each of those is an ACA opportunity, and the client just handed it to you because you asked. Source 2, the referral network. Once your Medicare client has experienced what working with you feels like, they are the warmest possible referral source for younger people in their orbit. Source 3, the community. Beyond the household and the referral network, there's a wider community of under-65 people you can reach without ever cold calling. Local small business owners and their employees. Self-employed contractors at the coffee shop you visit. The barber, the trainer, the realtor, the photographer. Anyone running their own gig is a potential ACA client. Most of them are paying too much for the wrong coverage because no one has ever sat down with them. You don't need to prospect aggressively. You just need to be the agent who happens to mention, at natural moments, that you handle health coverage for self-employed folks. The conversations come to you. Now let's solve the timing problem, because this is where most agents misunderstand ACA. Open enrollment, or OEP, runs every fall through mid-January in most states. Some state-based exchanges run a little later. That's when anyone who wants to enroll or change their ACA plan can do so without a qualifying event. But that is not the only window. Most ACA business is actually written outside of OEP through special enrollment periods. Here are the most common SEP triggers you will run into. Loss of other coverage, like a job loss or aging off a parent's plan at 26. Marriage, birth, or adoption of a child. Permanent move to a new state or zip code. Income change that affects subsidy eligibility. There are more, but those 5 trigger the vast majority of SEP enrollments. Each one gives the client a 60-day window to enroll. What this means for your calendar is huge. You don't have to wait until November to write ACA business. You can write it in March when someone gets divorced, in June when someone has a baby, in August when someone moves to your state, in October when someone loses employer coverage. Year-round, every month. The SEP calendar is what turns ACA from a seasonal product into a steady stream of monthly commissions. The rule is simple. When a client mentions a life change, your brain should ping. Job loss, marriage, baby, move, income change. Any of those, you immediately ask whether they have coverage in place, because they have a 60-day clock running and most of them don't know it. Now let me walk you through what this looks like in real life. You're sitting with Mrs. Cole, who just enrolled in a Medicare Advantage plan. The application is signed, you take the bridge moment, you ask the household question. Is everyone else at home covered the way you'd want them to be? She pauses. She says her granddaughter just moved in with her. The granddaughter is 27, just left a job, and is currently uninsured. That's a classic SEP trigger. Loss of employer coverage. The granddaughter has roughly 60 days to enroll in an ACA plan, and depending on her income, she may qualify for substantial subsidies. You don't pitch the granddaughter on the spot. You say something like, "It sounds like she has a 60-day window to get coverage in place, and she may even qualify for help paying for it. Would you mind if I gave her a quick call? Or if it's easier, I can send her a short text introducing myself." You leave with a name and a permission to reach out. You text the granddaughter that afternoon. You explain who you are, that her grandmother asked you to reach out, and that she has a window to enroll. You set a 15-minute call for the next day. You walk her through her options, you check her subsidy eligibility, and you write the policy. 2 days from the original Medicare enrollment, you've added a second commission, helped a young person get covered, and earned the right to ask Mrs. Cole for the next name on her list. That's the system. 1 Medicare appointment, 1 household question, 1 SEP trigger, 1 new policy. Repeat. Here's your action step. Today, 2 things. First, if you are not yet FFM certified for the current plan year, go to the CMS Enterprise portal and start the certification today. It is free, and it is the gate to everything else. Second, on your next 5 Medicare appointments, ask the household question after the application is signed. Is everyone else at home covered the way you'd want them to be? Track what you hear. You will surface at least 1 SEP-eligible person in those 5 appointments. Probably 2 or 3. That's a second business hiding in your first one, and it has been there the whole time.